1370 WOCA.
WOCA.
All right, 7 minutes after 11 o'clock. Nice looking Wednesday. Wow, it's beautiful out there. Dr. Riadh Fakhoury is in the studio. He's here to answer your questions about your health. This is the Head to Toe Care Show, and Dr. Fakhoury is a chiropractic orthopedist and the owner of Fakhoury Medical and Chiropractic Center, located at 1009 Southwest 16th Lane here in Ocala, right over Governor's Bridge. The phone number over there is 352, and then 351-3413, but the phone number here right now is the Climate Control Source Hotline, 352-622-WOCA. That's a mouthful, huh? Good morning, Doctor. How you doing?
Good morning. How are you, Larry?
Pretty good, pretty good. Well, every week we talk about something new, and today, I don't know if you've talked about this before. It doesn't seem like it's been recent anyway, and last week I helped out a lady that I know up in New York, and she asked me to ask you about whiplash.
Okay.
And actually, if you could add some of the legal parts of what the role of the doctor is with all that, because apparently there's some kind of when you're in an accident, you got to prove it or something. What is whiplash anyway?
Okay, that's a good question.
That's a good starting point.
That's a good starting point, and I really enjoy that. Sometimes questions come in during the week, which get our show started over here because they're always such good questions. Whiplash is really an older terminology, and it basically means that there's a sudden impact that's put to your neck, where your neck goes forward and backwards, or backwards and forwards, or side to side, but there's an undue stress, sudden stress that's put onto the neck, and that injures the structures. It injures the muscles, the ligaments, sometimes the nerves, the bones could get damaged, the joints could get damaged. So the technical terminology for whiplash is cervical hyperflexion hyperextension injury.
My goodness.
Yes. Sometimes people will call it a sprain strain. So we'll break all these components down. So whiplash is a general terminology, almost like when somebody says, I have sciatica, or I have a slipped disc. Those are very vague, large terms. So a whiplash means that there's an injury to the neck. Now, what could get injured in the neck? The disc could get injured in the neck, or the ligaments and the muscles could get injured. If it's just ligaments and muscles that are injured, then it's a sprain strain. It's similar to like twisting your ankle. Your ankle gets hurt, you pull the ligaments, tendons, it swells up, and that is just as important to take care of, if not as an injury to the disc. The reason being, if you twist your ankle and it's not treated correctly,
Right.
you have an ankle weakness and ankle pain, probably, and recurring injuries the rest of your life. And this is why so many people who get in accidents and have whiplash, they don't really, maybe they feel a little sore, but they don't take care of it right off the bat correctly, and that leads to long-term problems where they come to our office 6 months to 2 years after the accident in a chronic condition, which means it's been there for a long time. And at that point, then we're dealing with scar tissue and adhesions, muscle memory like we talked about before,
Right.
things that cause headaches, neck, trap pain that are hard to take care of because it's deep-seated now. There's a memory in the body for that. So what is a acute cervical hyperextension hyperflexion injury? Acute means it's recent onset. Cervical means the neck. Hyperextension flexion means the neck went forward and backwards excessively, more than it's supposed to. You and I, we could look down, we could look up, we don't have any problems, we won't have any pain from it. But if you get in an impact and your neck suddenly goes backwards, more so than it's meant to be, then things will get stretched and things will get injured. So that's where your muscles and your ligaments get overstretched, like twisting your ankle more than it's normally supposed to go. Now the discs are the cushion between the bones. If you extend and stretch them out, you could tear them, and you end up with disc problems in the neck, which then can make a vague, achy or pain in your arm, or numbness or tingling, or weakness or heaviness in your arms or in your legs.
Oh, wow.
So whiplash is a general terminology. It means that there's an injury to the neck. There's newer terminology that we use in our medical records. We call it a cervical sprain strain, or if there's a disc involvement, cervical discopathy. If it's excessive forward backwards motion of the neck, then it's a hyperextension hyperflexion injury. and needs to be addressed so it doesn't become a chronic problem. The medical legal part of it is that at some point, 2 years, 3 years, 5 years down the line, somebody's going to sit down with us, possibly in a deposition or in a trial, and say, okay, we want to understand what happened to this individual.
Yeah, yeah.
So it's very important for us, and that burden falls on the physician, Dr. Shanawani, our medical doctor, Dr. Teeter, Dr. Hutchison, Dr. Leone, our 3 chiropractic physicians, myself, and the staff, to be able to document what's related to this accident, what is not related to this accident, what's made worse, what hasn't been made worse. And then that way we can clearly define the injuries related directly to this accident and the care that this person needs, and the possibility even future care also. And the nice thing with Dr. Shanawani, being that he has 25 years of urgent care, ED, occupational background, he knows how to document that, as opposed to maybe a family primary care physician. They don't deal with trauma that much. They're looking at hearts and lungs and blood pressure, diabetes. That's what they're comfortable with. What we do at the Fakhoury Medical and Chiropractic Center, we look at that person from a musculoskeletal point of view and take care of them for their injuries that way.
The lady who asked me to ask you was the same lady who had the tumor at the lower part of her back.
Okay.
And apparently she's had that for a long time. Maybe it's just a whatever. She doesn't need to worry about it. But I guess the pain started coming from an accident in the car, which is where the whiplash question comes from.
Yes.
So I guess both things started hurting, the upper part and the lower part. And I guess the legal part is because I guess is there a stigma about whiplash? You have to kind of prove yourself to your insurance company? Is that what that is?
No, not really. Insurance companies are very good. They're going to take a sworn statement. They want to give you a claim number. They want you to get care for the problem, because they leave it up to the physicians to determine if that person is injured and the relatedness of the accident. For example, we had a gentleman come in after an accident. He was having bad headaches. Dr. Shanawani checked him, explained that the headaches are not accident related from the history and examination, but instead are related to a case of shingles, where the nerve ending was irritated from the virus nerve, causing pain into the scalp area. So that was not related to the accident. Versus if somebody has a neck pain and headaches acutely occurring or occurring just after the accident, and there's no other reason for it except the forward and backward. It took 2-3 days and they started noticing the pain. With history, with examination, the insurance company relies on us to give the correct information that they need, and that's why they're very thorough. They read the report and they make sure, and that's why when you get in an accident, you want to go to an office, as we do at the Fakhoury Medical and Chiropractic Center, treating auto injuries, specializing, really focusing on the care of 25 years. We know the nuances of the care of those individuals, because sometimes something may look and be perceived in a certain way, but it actually could be a problem that really needs to be addressed. And for example, Dr. Shanawani looked at a patient, and she was in an accident. She hurt her mid-back, and he evaluated her, ordered x-rays. Well, yes, she did injure her back musculatures and her spine from the accident, but on top of that, he found also tumors in the lung that were related to a lung cancer that she was unaware of.
Oh my goodness.
Sent her to her primary care and a CAT scan, diagnosed that, carried on her treatment for that with the oncologist while getting treated for the sprain strain injuries in the mid-back in the office. And so again, a good thorough report that clearly delineates, the fact that he has experienced 25 years in trauma. He knows what to look for. And us also with Dr. with Dr. Hutchison and Dr. Teeter, you really need to know how to take care of those problems, because you have a small window of maybe 2 months, 3 months to get that person to heal and recover, because after that it's more of a chronic condition.
And so somebody who had, could you get like a whiplash or something like from a bicycle or running? Does it have to be a car? Or?
It doesn't have to be a car. No, remember we said that a whiplash is a sudden onset of force on the neck that causes injury to the structures inside, below the skin, the muscles, the ligaments, the tendons, the discs, and the nerves. And so what it could be that you have your buddy, this happened at a bowling alley. Somebody came by, an individual that wasn't expecting it, and just, hey buddy, and slapped him on the back. Well, that caused an immediate backward movement of the neck, and so hence there was some injury to that, and the next day he felt it. And that's something we should talk about, is that you may not feel it that day, but you may feel it the second and third day progressively increasing. The reason being that when you are in an accident of any type, an injury, your body sends out pain relievers naturally that will help subdue the pain, and they start wearing off 48 to 72 hours later. Therefore, you start noticing the crescendo of pain over time, and that's why it's important to be aware of that and get it checked out. Even if you're not feeling the pain in that first or second day, it could be that there is an injury, but it's covered over by the natural pain relievers that your body puts in place.
Oh man, all the more reason why, if you've been through something traumatic. One thing that you said once really hit with me. You said if the car was in an accident and it does not look damaged, then the force went to you. If it didn't go into the car, I mean, how many people have had those little fender benders? It was nothing.
Yes.
But meanwhile, you just took a jolt.
And let's put that in terms that people who wear glasses know about. Let's say you're wearing glasses, and I bump into you, and I hit your glasses. Well, if your glasses bend, and the metal bends, and the nose piece gives and breaks, well, the glasses pretty much took that force, and you don't feel so much on your face because of the fact that they bent, and that metal bent and took energy or force away from you. Versus if I bumped into you and hit your glasses and your glasses didn't give, then that force would come directly into your face and you'd feel it, and you'd have more of an injury. So when a car gets hit, and the person comes and says, my vehicle really did a great job. It's small, it's compact, but it didn't even crumple. It stood the forces wonderfully.
Right.
Well, I'm worried about that individual, because that means since the car didn't take energy away from the occupant, when it was hit, all that force went directly to that individual or individuals that are in the vehicle.
Let's go to the phone. This is a fascinating topic, because I'm trying to figure out if the insurance company will believe you had an accident better if your car is wrecked. I'm not really sure.
That's a good point.
Wow.
Very good point.
Let's go to the phone. Good morning. You're on the air with Dr. Fakhoury.
Yes, good morning, doctor.
Hey, good morning.
Can you be trouble with falling arches in just one foot and not both of them?
Yes. When we evaluate people, if they're coming in with pain in the feet, maybe even pain in the knees or hips, sometimes we'll look to that low back. We'll look to the feet, and if we find that there's a flat-footedness or a pronation,
right,
most people will have it on both sides, but sometimes you'll have it on one side and the other foot actually rolls out. And that's a compensation by the body. The body knows that one side's going in, so it rolls the other side out. So you might be flat-footed on one side and excessive arch, and people realize that because sometimes they feel that they walk on the outside of one foot and not the other. Well, probably flat foot on the side that they don't wear out on the outside of the shoe, but the shoe that wears on the outside, they're rolling it out as a compensation. So what we do in a scenario like that is we build orthotics for both feet. One to support the arch on the right side and lift it up. Let's say the right side is the flat-footed side, so we'll actually lift the arch up to where its neutral or normal position is. And on the left side, where they're rolling out and they have an excessive arch, we actually develop a deep heel cup, so the heel sits into it, develops a sense of stability and comfort for that foot, so then the person will roll their foot back down onto the orthotic, which is like a bridge, so they'll support and it'll hold that excessive arch up.
Would many years in certain sports cause a problem like that?
Yes, flat-footedness usually occurs because of a breakdown of the arch. There's three arches in the bottom of your foot, and the main one that holds the arch that you and I are usually looking at, when those ligaments break down, they no longer hold the bones up like a bridge. It's almost like cables in a bridge. If they get stretched out, the bridge starts to sag.
Yeah.
And that's what happens is you get a dropping of the bones of the foot, and you start losing your arch. And when that happens, then the plantar fascia, or the thick muscle on the bottom of the foot, gets stretched out, and then it causes pain on the bottom of the foot.
Yeah, yeah. So you're basically saying that this could be corrected without, like, say, surgery?
Yes, yes. Rarely will surgery be done for flat-footedness. If you are extremely flat and you've actually ruptured a tendon that holds the arch up, then at that point they'll quite often either put you in a brace that will hold your foot up, or they'll fuse the bones of the ankle, and that's not good at all. So because you lose the motion that you're supposed to have. But sports that can cause that are very hard pounding forces on the foot, wearing shoes that don't have good support within them, so the foot hits hard and there's nothing to support it, so the ligaments get stretched and the bones collapse. Also, pregnancy will do it too, because there's a hormone in the body that comes out at the very end called relaxin that stretches all the ligaments in the lady's body to be able to allow for an easier pregnancy. Well, the foot also, those ligaments in the bottom of the foot that hold the arch get stretched out, and the arch will drop at that point.
Is that a lengthy thing to have to get corrected?
Well, you will not correct the flat arch. When the arch drops down, you can only support it, but you usually, rarely, unless you're very young, rarely will you get that arch back again. So it's almost like having a poor vision and needing glasses. When you wear the orthotic and support your foot, it's like wearing glasses and getting better, clearer vision. When you take the glasses off, then the foot drops back down again.
Is there a lot of pain and discomfort with something like that if it's left long enough? Yes,
because when the foot drops, then you usually form a bunion, which is the arthritis of that first joint. And that could be very painful when you wear tight shoes, and it could be quite painful also when you're walking. Secondly, arthritis will form a little more rapidly in those ankle bones. And then also, when you roll in and you're flat-footed, your knee's susceptible to inside stress, so you'll usually have pain on the inside of the knee, the outer hip, and the low back also. So yes, it can cause pain.
Okay, thank you for your answer.
Oh, excellent question. Thank you.
Bye now.
Thank you. Bye-bye.
Thank you for the call. And in fact, everybody's invited to call. If you have a question for Dr. Fakhoury, don't hesitate, and you are invited. So go ahead and call. We are live today, by the way, Wednesday, January 30th, 2013. And the phone number is the Climate Control Source Hotline, 622-WOCA. Okay, so the question that I had, that kind of the follow-up question to the earlier one, and if you're in a car accident and you need some medical treatment and you've got insurance, but the car really isn't hurt, does the insurance company, and I sound negative on insurance companies, don't I? But I'm wondering if they question it.
It's hard for the adjuster because they're displaced. They're not connected with the patient. They're not talking to their client, so they're off-site. So they depend again on the physicians to be able to give the indicators as to what has happened to this individual and what care that they need. For example, if there's not much damage to the vehicle, but in our notes we're reflecting that the patient is having pain in the right arm, we do orthopedic neurological testing and we confirm that. Then the adjuster understands. At that point, if we do 1-2 weeks of treatment through the rehab, the massage therapy, the chiropractic, and they're not really responding like they should, if we're ordering an MRI at that time, then the adjuster understands why, because he understands that there's a possibility of a disc problem causing this right arm pain. So the adjusters do well when they are getting information, and the insurance companies do well when they are dealing with an office that they know is familiar with treating these problems and knows how to do that. So with our documentation and our explanation of what care the patient needs, the adjuster or the insurance company is reading that information, and we're giving them clear guidelines and an understanding of what the patient's experiencing, what's related to the accident, and what they're going to need also for proper care.
If I'm a passenger in the car and the driver is not a good driver, and he goes over this railroad crossing really fast, and the car does a big, almost mid-air moment, there's not really an accident, but there's a sudden jolt to me.
Yes.
And now I'm saying, oh man, I think I think that hurt my neck.
So like Starsky and Hutch, you're up in the air.
Right. Or something like that, or something maybe, or like if you spin out, like a lot of God forbid you're not hitting anybody,
right?
But you hit a patch of something and your car spun around, didn't flip.
Right. That's right.
And you're on your way, but you just got tossed around.
What we said that the terminology whiplash is a sudden force on the neck that causes injury, and that can happen without a direct hit from another vehicle. You spin off the road, you recover, the car is spinning back and forth, you're tense, your head and body are going side to side. That can cause an injury. You'll feel it the next day or 2 days or 3 days afterwards. That needs to be treated just as aggressively as somebody who was in a direct collision with another vehicle, because again, the ligaments and the tendons are very important to take care of, because people might say, oh, I just sprained my neck, it'll go away. Well, the fact is it usually doesn't, and just like a twisted ankle, a sprain of the ankle, it'll show up 6 months to 2 years later. And as you know, we're under new legislation and new law that says that you have only 14 days to come in after the day of the accident to receive care, or you lose your benefits. Where prior to January 1st, you could come in a month or 2 or 3 and say, Doc, I was jostled all over the road. I thought I was okay. It's 2 months later. My headaches aren't going away. My neck pain is not going away. It's getting worse. I've been eating Advils. The pain is not getting any better. Back then, we were able to treat them and just explain to the insurance adjuster, and they would realize through a history. But now, if that's the case, there's no coverage. So we have to see that individual within the 14 days if they want to be covered under their automobile insurance, or they'll lose their benefits.
Okay.
And furthermore, they are only allowed 25% of their coverage unless a medical provider like Dr. Shanawani says they need treatment, and then they can open up the full coverage at that point.
Okay. And I guess you answered my next question, which was, would an insurance company be there to help you out with payments if there was no other car, and if there was like going to the Starsky and Hutch thing or the spinning out thing? I mean,
yes,
that's insurance applicable too, right?
Anything related to the vehicle where there's an injury. For example, let's say that your child closes the door, your hand's in the door, and you may have fractured your finger.
Oh, wow.
That is related. It doesn't have to be a collision, and people don't realize that. We've had one gentleman getting the spare tire out of the trunk of his car, and he actually hurt his disc. He herniated his disc because he was bent over and pulling it out.
Yeah.
But because it was connected with his vehicle, just almost like your homeowner's insurance will connect you to a structure,
right?
This is connected to a vehicle, so his treatment was under the PIP, or personal injury protection, basically injury to the body related to the vehicle. If we submitted it under his health insurance, let's say Blue Cross Blue Shield or United Health or Cigna, and they realized that it was connected to the vehicle, they would have wanted to be reimbursed for the care, because it has to go to the insurance directly related to the situation. If somebody hurts himself at the house, it goes under homeowners. If somebody hurts himself at work, it goes under work comp. If somebody on a personal basis is working in the yard, it goes under their health insurance. If there's something connected with the vehicle, whether it's a direct collision or something related to the car, you're working and the hood drops down on your head and you're feeling dizzy, that would be related to the automobile.
I hate when that happens, right?
Well, you gave us the story where you were up on a vehicle and you fell down.
I did.
That would have been related to that vehicle.
Wow. Well, I never did anything.
I know. Well, thank God. 3 songs later, you woke up,
But, and I don't know if I shared this with you, but when I did have the car accident, and Jamal, your brother worked with me, he did an x-ray, and he found something new in my neck. He showed it to me in the x-ray, but he also found something old.
Yes.
Who knows where that came from?
Right, and that's where we have to really clearly delineate what's new and what's old.
Yeah, it was a fascinating experience, actually. Good morning. You're on the air with Dr. Fakhoury.
Good morning. Good program. How does Medicare enter into assistance with payment for injuries that you treat?
Oh, wow. Good question. Thank you very much. Let's look at the. You're speaking specifically of a motor vehicle accident or injury with a vehicle?
No. not related to a vehicle.
Not related to a vehicle. Okay. Well, the advantage that we have at the Fakhoury Medical and Chiropractic Center is we have medical and chiropractic at the facility, at the same facility. So in a scenario like that, when you are coming under Medicare and you need to be looked at, you can be seen by our medical physician. So if x-rays or something medical needs to be done, we can do that at the same day. And then at the same time, chiropractic also. Medicare is very good in being able to help people with neck and back problems with recovering through chiropractic, as well as now, because we do have Dr. Shanawani is a medical doctor, so in our facility being multidisciplinary, we're able to help the person from multifacets. Most people, they just come in, all they need is the chiropractic, but if they're in severe pain and need to see Dr. Shanawani, maybe they need a light muscle relaxer, light anti-inflammatory, something light for the pain, he's available to be able to help them with that also if necessary.
Do they limit the number of visits or the total amount of care that they will participate in?
Well, I've been in the chiropractic field for 28 years. When it started, when I started, Medicare had no limitations on chiropractic, and then they limited it to 24 visits. Then they limited it to 12 visits. Then they limited or raised it back up to 24 visits, and now there's no specific visit limit. Treatment is based on acute conditions or flare-ups. For example, you wake up, your neck is hurt, you go in the yard, and your back is flared up. Then they will cover that. They won't cover maintenance or wellness care, but they will cover acute flare-ups or new problems that arise, and they don't really have any limitations as long as it's medically necessary and the treatment is specifically to that situation. And when it's resolved, we terminate the care off of Medicare.
Well, that being applied to like a rehab type situation.
With physical therapy, they have an X amount of coverage that is allowed, and usually with the physical therapy and physical rehab, for example, if you go to a physical therapist, if you have a prescription to go to a physical therapist and see them, usually you'll have a course of treatment of 3 weeks, 4 weeks, it might be 8 weeks, depending on what your problem might be. If you have a sprain of your low back, it might be 6 or 8 visits that you'll go to physical therapy. If you've had surgery on the shoulder and you had a shoulder replacement, it might be 8 weeks of rehab and physical therapy to be able to redevelop the motion and the stability of the joint.
Okay, good information. Thank you. I really enjoy your program.
Thank you so much. Thanks for the questions.
Yeah, and if you have anything, I mean, I'm wondering how many people are hearing us right now and saying, you know, I did spin out like that, and I didn't have an actual wreck, but I didn't know that I could use my auto insurance to help pay for it.
Well, it's pretty much we all have, and the listeners have insurance for a reason, but there's different categories. So
yeah.
Part of our treatment at the Fakhoury Medical and Chiropractic Center is to determine and make sure that the proper situation is going under the proper insurance, because that's our job. The insurance companies depend on us to do that correctly. So for example, somebody comes in, they've had a whiplash injury to their neck, they call the adjuster, they open up a claim number, and they'll come in and they've never had a problem with their neck. And then, Larry, let's say they have a chronic problem with their low back. It's been ongoing for years. They go, you know, Doc, my neck is feeling so much better. Can you do something for my low back? Yes, we can, but we have to open up a separate file, individual, maybe under Medicare or health insurance, completely separate and unrelated to the care that we're doing on the neck, because insurance companies depend on us to do things correctly and accurately, so our notes are reflecting the right situations, because that's really all that they can rely on and depend on us with. So
because of the fact that the Fakhoury Medical and Chiropractic Clinic has several different types of doctors, you could kind of, I guess, use each other to say, you know what, you would be a better doctor for this particular patient.
That hits the nail right on the head, because most people coming in will be seen through the chiropractic and the mobilization. But somebody might come in that is in such severe pain, they're just bent over, they can't, they're just so uncomfortable. At that point, they can see Dr. Shanawani immediately without having to wait 1, 2, 3 weeks and then be seen immediately. We don't do primary care, we don't do urgent care, but we will help that person right then and there and help them. It might be sometimes there's a Toradol injection, which is like a large anti-inflammatory, and within 20-30 minutes the pain is subsided to a point where we as chiropractors can now adjust and help that person, where before it would take us a week or two before we could even help them. So we could accelerate that process and utilize different facets of the office. And for example, one person, her neck was so sensitive, she was not a chiropractic candidate, but she was a candidate for massage therapy and interferential therapy and laser surgery, laser treatment. So she did very well with that. So we can pick and choose what's going to be best for that individual.
By the way, just a quick note. Robin's mom's birthday was Saturday.
Okay.
She announced to everybody, I don't want anything. If you're going to get me anything, get me a massage.
Wow.
So that and Valentine's Day is coming up. It's a nice idea for a gift.
Yes. Yes. Actually, if anybody wants to get their loved one a gift certificate, just come to the desk. Call the office 351-3413 option 4. Just say I want a gift certificate. Come on in. Amy, our patient care coordinator, will put it together. Very nice certificate. It looks nice, and what a nice gift. A gift of health, something that's relaxing that'll be remembered forever.
Yeah. Or at least till next birthday, right?
That's right.
Or next Valentine's Day,
That's right.
Right? Well, Doctor, thank you for all you do for us, for helping us understand our own selves, and we'll see you next week.
Thank you very much.
We'll take a little break, and we'll be right back.
Accident, injured, hurting. Pain affects so many of us and keeps us from enjoying our daily routine. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Let me visit with you to answer your questions. Let us help you help yourself on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA. Again, that's Dr. Riadh Fakhoury, here to help you on the Head to Toe Care Show